Perfect. Awesome. So officially, I'll welcome you guys to the May study club. This month, I decided to talk about burnout in the dental practice because it's something that I felt was coming up as a topic with a couple practices that I was speaking with. And so I wanted to just open up a discussion about it in the study club to see how maybe some of us are supporting our team members, and also for ourselves, making sure that we don't have burnout. So I'm going to also share my screen so you can see it here. Perfect. Okay. Awesome. All right. So, and the funny thing is some of the slide picture that you have to laugh at. You can make fun of them, especially this next one, which is kind of funny. Let me see here. I think it might have a slight delay, but let's get going. Just give me a second. Oh, funny. I don't think it's moving to the next slide for some reason. Sorry, guys, give me a second here. Okay. No, it might not. Actually, I don't know why, but again, this month I've got a glitch. So I'm gonna carry I'm gonna carry on.
Bad.
Oh, I'm sorry, guys. Anyway, what I wanted to talk about is why mental health matters in dentistry. We have a very high stress work environment. Um, we're fast-paced schedules. We have perfectionism. We're dealing with patients with anxiety. And then also the physical demands of working in an operatory all contribute to elevated stress. And then, as some of us may know, that dentistry consistently ranks among the professions with the highest risk of burnout, depression, and even suicide. Um, Even unfortunately, I think I've heard of a few dentists that have actually um, really quite sadly committed suicide. It's devastating to the practice and to the patients. It's something that we should uh, be comfortable talking about, because I think when it comes to mental health, part of the stigma is the shame or not being very open to discussion. So one of the things I want to make sure in this session is that everyone is able to talk about it comfortably, and be respectful of maybe some of the experiences that we may have had. Um, just a question is that I wanted to pose to you guys is, why do you think dental is uniquely stressful? Maybe what are some experiences that you've had, or stress that you've encountered with your team members?
I think something that we overlook is the fact that a lot of the patient, I won't say all of them, but a lot of them really doesn't want to be in our clinic.
Mm.
And they keep telling us, oh, we don't like go to the dentist, but I know I have to. And if you hear that over and over, it's easy to think, oh, but yeah, people don't like me. It's me. It's me
Yeah.
that they don't like. It's but it's actually the treatment that they don't like, or the experience. And I don't always think we realize how hard it is for some people just to walk through that door.
Mhm.
For us that do it on a daily basis, we can totally forget about it. But some
Mhm.
people really have a tough time, and to deal with that people on a daily basis, I think it's just very emotional draining. That's
Mhm.
why it's one of the reasons why our clinic works 4 days a week, and we said we work hard for 4 days, but 4 days is enough, and then we need a different outlet to
Mhm.
regroup and refocus and come back next week.
Yeah, it sounds like your practice has a very good balance between work and life.
Yeah,
So
because
even
we that's I think that's really important for everybody. Everybody.
Mhm. Yeah. So there's no associates. There's no, but your office is closed for 3 days a week.
Yeah.
Yeah, that's impressive. That can be that can even be a hard choice to make because you think, oh, lost revenue.
Mm.
But at the same time, when you show up and you're well rested and you've had a reset,
Yeah.
you're able to um, probably able to be a bit more productive than if you were feeling,
Yeah.
that fifth or sixth day in the week.
Yeah.
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 Tamara, did you have anything to share?
I was just going to add, my dentist, didn't fill the schedule for one of his days last week, and it was a 2 hour block.
Mhm.
And I said, our job is to fill the schedule, and you want to be busy, productive, all that kind of stuff. And he's like, you know what? I could use a break.
Oh,
Aw.
wow.
um, I don't think he might be overworked. He might feel that way, but just to like keep on top of lab cases, because he does implants, so designing, um, treatment, and all the other background work that dentists do that we don't
Mhm.
see when they're not with a patient. So I think that was a nice breather for him.
Mhm.
um, it was just funny. It was like, are you okay with the schedule not being filled? He's like, actually, I'm
Yeah.
good. He's like,
Yeah.
I need a break. Like, it's good to have breaks. um, and him and I block the schedule to have meetings, just to make sure that we're running the business properly, and we do that. But yeah, it was refreshing that he, because he's a workhorse, he likes to work hard and make sure the schedule's busy and work. But um,
Mhm.
it was nice to hear him say, yeah, no, I need a break. I'm like, okay,
Yeah.
good,
Yeah.
let's catch up. Let's
Mhm.
just not have anything for 2 hours. And then, that helps the assistants, and
Mhm.
Mm.
that helps the sterilization, where they can keep on top of the other things that kind of get put to the side because we're so busy, busy, go, go, go.
Mhm.
So yeah, this is something small, but
Mhm.
it was nice to hear him say that.
Yeah. Little reprieve. I have a client who's a specialist, and he'll block off half a morning um, every other week, and sometimes half a day, or actually a full day, just so he can catch up on. He's still working, but it's working outside of the operatory because every 10 minutes of his day is filled with jumping from one patient to another. So just recognizing that being able to log off time of non-production time in quotes, um, to catch up on paperwork and also just running and managing a practice is important as well, um, rather than filling every second of your of your day with patient time, right? Just having the understanding the importance of doing that, so you're not spending your going home, spending your evenings doing like charting. And I have dentists
Mm.
that do that. They spend hours once they get home, put their kids to bed, and they're log in and they're charting. Like that's we want our dentists to go home and enjoy their family, not more work. So it's
No.
trying to figure out how we can support them so that they
Kind of
can,
like how teachers operate.
right?
Yeah.
Yeah,
They go
Yeah.
home
grading
and then they
homework,
mark, and
right?
then
Yeah.
yeah,
Yeah.
I don't want to take work home. I mean,
No.
Mm.
Yeah.
But to that point, Monica, that's one of the things that one of the biggest changes that we saw when I joined the clinic for Liana, when
Hmm.
she could focus on just the dentist part and do her work at work and don't have to worry too much about it after work, she
Hmm.
became a totally different person,
Yeah.
and she knew things were taken care of. So that's why I think, and tomorrow you play that role too, is I think that's important. So that kind of support that the office manager give to the dentist is really valuable for them
Mhm.
to be able to focus on what is important.
Yeah. And I
when
and I
he
feel,
first hired me, oh, sorry,
oh,
when he
no, go
first
ahead.
hired me, I said to him, I want to run your practice. That's
Yeah.
my goal. Like, that's what I want to get up to.
Hmm.
And so I'm getting there. Like I'm still learning. Like I said earlier, there's no office manager course that I could take.
Hmm.
So it is learn on the job and learn as you go. But I said to him, I want to run your practice so that you can go home at the end of the day,
Right.
Yes.
do your dentist thing, and you don't have to worry about the other stuff.
Yeah.
Um, I mean, he's still gonna have to be involved. You're owning a practice. That's comes with the territory. But yeah, it's funny that I said to him, I want to
Mm.
run your practice so that you
Yeah.
can take a load off at the end of the day.
Right.
Yeah.
Yeah.
Yeah. Sometimes it's hard for dentists to delegate certain things. Um,
Mm.
Actually, I have this worksheet that I can send you. I created it recently, and it's to help the office manager and the dent practice owner be in alignment, so they can
Mm.
kind of understand, what decisions do you want me to make on my own, and which ones do you want to be part of, or what goals do you have? And it kind of just gives directions so that um, they understand each other and are in alignment. So
Yeah.
I can send that to you guys
I would love that. Thank you.
afterwards, because it also just opens a dialogue too.
Yeah.
Absolutely.
Um, and I one of the things that I'm thinking about when we do the burnout is a lot of times we're looking at the team members, which I think we should still definitely do, but I think we also need to look at the dentist as well, because
Mm.
they're the practice owner, but no one's really checking up on them. There
Them too.
A lot of times the dentist is making sure everyone else is happy, where no one's really kind of checking in with it. And I feel as office managers, that's part of our role, is to also um, check in with the dentist to make sure they're okay and not burnt out. Um, and as office managers with ourselves, right? Because you cannot take everything on as well. So I think it's also, um, you know, caring and taking care of management and owners, and but just not to say anyone's more important, but sometimes focuses could be on the team or the team's need, and I think it really needs to be everybody in equal terms.
Yeah. Yeah.
I totally
Absolutely.
agree with that. One time, I see he's stressed or he's sitting in his office and he's like just leaning back,
Yeah.
Um, like, how are you? Are you okay? Like,
Yeah.
Yeah.
you need a day off? Like, can I block your schedule? Right? Like, just checking
Mhm.
in.
Yeah. Yeah. Because we
That's
don't
a
want
good
to
point.
forget about them too, right?
Hmm.
Um, anyway, just a thought as well of that, the importance of them. Um, and then I wanted to also talk about common stressors for the dental team. Um, I think time pressure is huge, especially the stress of falling behind, or when you have, you have two patients waiting for you in the waiting room, and you're, I mean, that in itself causes a lot of stress for the clinical team. Um, and then also perhaps even having production goals, when there's a hole in the schedule, or if there's the expectation we have to make this certain amount each day. Some offices focus really heavily on that, and that can cause a lot of stress for the team. Also, even just dealing with patient challenges, managing fear that they have, and anxiety, or even difficult interactions. Because I know for me, when I get stressed out, my body temperature gets really really hot, and some people even will turn red. You'll visually see it, and others you don't, because some are silent stressors, and then others might be quite vocal about it. So you have an array of different personalities, and it's being able to make sure the person that's not visibly stressed is getting more attention than the person that might be a little bit more quiet about it. Um, is there any situations that you've observed in your with your team of how you've noticed that people have been stressed out, or you've had concerns for them?
We had a situation recently where the dentist had dealt with a difficult case, but it involved the dangerous as well. So he was working with the patient, getting the extractions done and getting that all done, while the receptionist was scrambling to find the dangerous and lining up the dangerous so that the patient can go straight from the dental office to the dangerous. And but there's a lot of back and forth. So the appointment ran longer. So the receptionist had to readjust and spoke with the dentist, and so she was working on the one end, trying and made some promises, and the the dentist actually bent over backwards for us,
Hmm.
and she wanted to convey that information to the dentist. But she didn't realize how stressed the dentist was with this case and how difficult it was. And it was on a Thursday before a weekend, wanted to get things done so that the patient have something for the weekend and stuff like that. And the two of them got in each other's hair and overreacted in the situation
Huh?
because they didn't seek to understand each other's situation. And I get it in the heat of the moment, it's difficult to put put yourself down and say, okay, I'm going to focus on the other person. In the heat of the moment, you stressed, you just want to
Hmm.
you want to defend, you're in the defensive mode.
Hmm.
So I sat down with both of them individually and talked to them about the situation, and they now understand how they could have dealt with it differently, and hopefully they will take that forward and deal with some
Yeah.
things a little bit different. It's just understanding because they work in isolated areas from each other in some cases.
Hmm.
Mm.
Recently, I might even been during that panelist meeting we had last week, but in the last week somewhere, I can't remember exactly what moment it was, but the idea was to have team members observe, like swap roles, or
Mm.
to have like a clinical team come sit with the admin team for a while and
Yeah,
see
yeah,
a little bit of what they do. So, and I again, some of the words that you used is to understand. I think if we have a little bit more understanding about things that can cause different roles in our office stress, um, we be a little bit more empathetic to them. Because I think one of the problems that we have is we really don't understand what it's like to be in that position or role, and we're kind of focused on ourselves. Like I'm stressed out. You really don't consider, maybe the other side of things. Um, so I really like that idea of taking some time out of the month to have maybe the hygienist sit in with the dentist or the administrator, and have the administrator come and observe what happens in the dental chair, so you can kind of see um, what happens, and realize, oh, okay, you know what, this is hard. I can understand a little bit more about some of the pain points of their position. So I really thought that was great. And it might be something that you'd say, oh, I don't have time to do that. But I think maybe investing a little bit in that exercise would pay off for sure.
I like that. We have that as like a downtime task. If,
Hmm.
mm,
patient cancellations or we've just not got a busy schedule, and kind of like as a last resort, all everything else is done, and we're twiddling our thumbs like what to do. That's on the list. Like go walk a mile in somebody else's shoes.
Hmm.
But I like the fact that you said like make a point of it, schedule it, like don't just wait on it, like make a
Yeah.
point of getting it done. So I like that. Um, Something
mm,
that comes up for us is time. Just it's always time.
Hmm.
One of our dentists he was the original owner of our practice, and now he's semi-retired. He's works as an associate 2 days a week, but he's built up all this relationship with all his patients. So,
Hmm.
and he's a talker, so he likes to talk, and so we book in talking time for him because it's
Yeah.
his socialization, right? It's connecting with those patients, and they have a relationship, and I love that. um, but then it puts us behind because they don't get started with the procedure
Hmm.
20 minutes into the appointment. Well, then we're behind, next patient's waiting, and then it causes everybody stress,
Right.
like you said. So like kind of planning for that, giving him, okay, you got 10 minutes of talking time.
yeah,
Hmm.
And in his, I don't want to say age, but he's slowed down. So just noting down that he's not as fast as the principal dentist at our office, so just allocating like time for that so that we don't put ourselves in that situation.
Hmm.
um Now we can't control if treatment changes and they're running behind for other reasons, But we can try to prevent it as much as possible.
Mhm.
But yeah, time, it's when we're running behind in the chair, the CDAs are stressed because they have to catch up with Steri afterwards, but they've got to dismiss the patient, then they got to set up for the next patient, and it's just a snowball effect.
Yeah.
And then the patients are waiting, so it causes the whole team stress. And so
Mhm.
then it's my job to plan out how we're going to handle this, notify the patient, blah, blah, blah. Anyways, that's a big stressor for us is when we're running behind, and
Yeah.
um, it's the time. So
Mhm.
Yeah.
we try our best to prevent it, plan for, the dentist having his talking time, his catching up with his patients. And like I said, I love that he has that relationship with them. But if it's going to put others into stress mode,
Mhm.
to keep up, and it's their
Yeah.
job to make sure that they keep the dentist on time, and then like I said, we'll try to plan for that. But sometimes it's out of our control
Yeah.
too.
And I think allowing time for talking is important because that's where relationships are built and there's connection with the patient. So that is
Absolutely.
important. This week I listened to a CDA say the dentist. She said, when you tell the admin how much time you need for an appointment, please remember to include my time for cleanup and setup.
Yeah.
And
Oh,
and it's basically I loved that they communicated that because
Yeah.
you kind of think about the things that you need to get done in the hour, but you're not necessarily thinking of the things that your team needs to get done in that hour. And
I love
so it
that.
really kind of made a note of saying, remember my portion of it. Don't just think of what
Yeah.
you need.
Mm,
And I think that's helpful because then they allow for the time for that. Like you said, the talking time.
Yeah.
Please allow for the talking time, setup
Yeah.
time, and
Yeah.
so that you
cleanup
really,
time, stary
yeah.
time, right?
And
All of
it's
it.
hard to kind of try to figure out how much time you'll need for certain things because sometimes things do get more challenging and take
Yeah.
more time. But if you
Mm,
allow for it
Yeah.
and talk to the team about um, maybe scheduling enough time for all the things that are
Yeah.
um, encompassing of that appointment as well.
I
Yeah.
love that.
Yeah.
I,
I love that.
I think the other thing that creates unnecessary stress or additional work for that matter is if we're not in some areas proactive enough to
Mhm.
look ahead in the schedule to see, oh, this lab case is supposed to be back that day. If I don't follow up now, it's not gonna be back. Or we have an implant. Do we have all the parts, all the scan bodies, all the information that we need for that implant? If you catch that ahead of time, there's way less scrambling and stuff. And then even if you do the scramble to get at, if you do that 2 days prior, it's a lot easier to do that than during the appointment to rush and say, oh shit, I don't have this, we don't have that.
Mhm.
But we're getting our staff to look ahead in the schedule, but I still think there's training needed for them to what to look for. Sometimes they look ahead in
Mhm.
the schedule and all they see is the gaps.
Yeah.
They don't
Yeah.
drill
Yep.
down into some of the details to see, okay, if I envision this is how is this going to happen in 2 days from now? What do I actually need to make sure this is smooth and flawless?
Mhm.
And that proactiveness is something that is not natural to us. We need to work on that to get that done.
Yeah, plan for the inevitable. And I think when you
Yeah.
look at the schedule, it depends who's looking at it. The dentist might look at the schedule and see the holes. The
Mm,
Yeah.
CDA might look at the schedule and see the overbooked or like
Yes. Yes.
like
Yes.
so you're
Absolutely.
looking when you look at the schedule, depending on what role you are, you're looking at different things. Like an
Totally different.
administrator's not going to look at a schedule the same way a dentist does.
Yeah.
And I think it really comes down to communicating and understanding each other.
Yeah.
This last weekend I was at a retreat, and one of the activities that the team did is they broke into their departments like hygiene, CDAs, admin team, dentist, and they wrote down all the things that a hygienist does that they love. All the things the dentist does. I love it when you bring the patient to the front and you say, "What's next?" Or I love it when whatever the item was, and then we shared that together. Um, and I love that they looked at it as a positive. So it wasn't I
Yes.
hate it when it's I love it when you do this because when you let someone know this behavior, I really like this, they're going to want to do more of it. And
Mhm.
so making the time to communicate things that are important depending on what your role in the office is,
Yeah. Yeah. That's good.
can be valuable. So that could be something you could take back to your team.
Yeah.
And also that a day goes really well when these things happen. Um,
Mhm.
and,
Yeah.
and so the
Yeah.
other team uh, member will say, "Oh, you know what? I know the administrator really likes it when I write down like the treatment plan and give it to them, um, or the amount of time needed, or just something really small sometimes. Or it would really help me if you did these things so I can do my job of this, because it's almost like passing the baton, where really need to communicate from one role to the next, because it takes the whole
Yeah.
team to provide the best service for a patient. And if someone drops it or they're not given all the information needed to, get a service done for the patient, it's also recognizing that what I call pain points, like
Mhm.
under what circumstances do things kind of break down, and then how can we fix that.
Yeah.
But anyway, you guys have had a ton of great insights on that. So I appreciate your contribution.
Mhm.
Um, and then one of the things I also wanted to talk about is how managers can support mental health. And you think, oh, it's not my job to take care of your mental health. Um, but it's important um, to check in with people and recognize, because if somebody comes into work and they're having some stressors at home that maybe they're not sharing, they don't have to necessarily give you the details of things, but I think it's helpful to know, um when you come in, have that huddle, what support do you need today, like,
Yeah.
um someone could say, I have a really bad migraine today, so if I'm slow, or like, please understand why. I'll do my best, but I'm really not feeling well. I can work, but
Mm.
I'm suffering from a headache or a migraine, or my
Yeah.
child kept me up all night. Just understanding that gives you a little bit more empathy to the person. And again, you don't want them to show up every day. Oh, I have a headache today. I have a headache today. Because then it loses. You kind of lose a little bit of sympathy for somebody.
Yeah. Yeah.
Um, but also just say, you can even as a manager say, you know what, I'm having a really hard day. I'm gonna try to be there for everyone, but just so you know, and making it okay to be vulnerable and kind of share these things um, can help you lead with empathy and normalize these conversations. Because if someone doesn't feel safe to share, you're not going to know that information, and it's going to affect the team dynamics that day.
Yeah.
Um, what are some things that you have done, or what are some things that maybe we could do to help support our team in the way of mental health and support?
Yeah, I think one of the things that you can do, and it's also against our natural instinct, is just to listen. Sometimes
Hmm.
people go on, and all they need is not for you to give comments or give an example of how it happened to you or what you experienced. It's just to listen to what they have to say, even if you don't agree what they have to say. Sometimes just listening to them and let them speak their
Yeah,
heart out in whatever shape or form makes a huge difference for some people.
I
Um,
think that's I like the number one thing I think you can do.
yeah,
And I think that's listening is an underutilized skill of leadership. Sometimes it's not thought of as being very important, or a skill itself, but
yeah,
just listening, and also allowing people to know, you know what, if you ever need to talk, I'm here for you.
yeah, yeah.
Yeah. It's so simple, but it's so true.
Yeah. And Monica, but one thing I need to I'm working hard on the listening side, but one thing I need to hold myself back with is I always want to give advice. It's from my engineering background. I always want to fix something and say, okay, this is the problem. I can clearly see what the problem is. This is what you need to do. This is how you need to handle it. And sometimes I just need to restrain myself and say, hey, I don't need to give advice. They have to
Hmm.
figure it out.
Right.
And me telling them what to do is not going to help the situation. I just need to say, yeah, I agree. Yeah, that's a tough situation. That's a tough time. That's not fun to deal with.
Hmm.
And prevent myself from giving advice and taking over the conversation that way. That's the biggest challenge for me.
Yeah.
I think when it comes to problem solving, I have let my team come to me. Oh, can you help me with this? And then, yep, you just do this, this, and this, and you're done. And I fixed it for them. I
Yeah.
gave them the tools of how to figure it out, how to get there. I think for myself, I need to stop and hear what their problem is. So you said, like you said, listening and try to empower them to figure it out on their own. So I like what you said.
Yeah.
I'm not fixing problems anymore, but I'm giving them the right tools
Yeah.
and even when it comes to mental health, okay, how can we support you at work? You're dealing with something. Okay, what tools do you need to
Yeah.
keep working, but also deal with what you're dealing with? Um,
Yeah.
yeah.
And a good question that helped me with that is when they come with this problem, with this idea or this challenge, my question is always, but what do you think? How do you think we should handle this? What do you think?
Mm-hmm.
Like my kids get really frustrated with me if I do that with them. But it really helps them, and it's probably not fun for them to deal with that issue now if they don't want to deal with it, but it enables and helps them to create the skills to deal with it in the future.
Mm-hmm.
Yeah.
I think there's moments where you kind of do you need to take away someone's um um I don't want to say problems, but say, you know what, I can do this for you. I realize you need to take a step back. There's
Yeah.
moments where you need to recognize that that's what you need to do, and then moments where you just need to support them and say, what do you need from me
Yeah.
to help you in this situation?
Yeah.
So sometimes it's having a bit of discernment and knowing when do I
Yeah.
need to step in, when do I need to step back?
Mm-hmm.
And
Yeah.
that can be something that's really hard to recognize.
It's a challenge. Yeah.
But
Yeah. That
almost
is.
just asking them too, do you need me to step up or step back? Or
Yeah.
it's almost like when someone comes to you with a problem, do you need me to listen or do you need me to help you solve it?
Yeah.
Because it's
Yeah.
like,
Yeah.
Are we venting
Yeah.
or are we just,
yeah. Are you
Yeah.
looking for advice or you're just looking to vent? Yeah.
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 Just maybe, and also maybe it's just a communication skill, like of saying, what do you need or what do you want
Yeah.
um,
Mm,
from me?
yeah.
Because sometimes a person's gonna say, you know what, I just wanted to say that and get it off my chest. Nothing needs to be done or fixed.
Yeah.
Just I just needed to say my piece and go on.
Yeah. Be done with
Um,
it. Yeah.
I think one thing for mental health is my office runs hot, but just in general, but my door is always open. And I say
Mhm.
that literally and figuratively, like if
Mhm.
you need anything, like something is bothering you at work or at home or whatever, like same thing. You need to come vent
Mhm.
or my door is always open, like just come talk to me. Something we do is not quarterly, but every 4 months we do a feedback session, just like as a check-in, like, hey, how's it going? How are you feeling? How are you doing? Just like work specific.
Mhm.
How's it going? If we hired somebody new, how's it going? How are you feeling? Are you overwhelmed? Like, do I need to take something off your plate so that you're not so stressed? Um,
Mm.
we do give them a questionnaire just so we can keep record of it. But yeah,
Mhm.
like, how's it going? What do we need to do? Do we need to step back? Do we need to like take this on? Do we need to give you more work? Are you tired? Are you bored? Like,
Yeah.
how can we make sure that your time at work is efficient, but also um, productive?
Yeah. I think
Um,
that's wonderful that you do that, Tamara, because um, sometimes
Mostly just to highlight the overwhelm. I just don't want
yeah,
anybody to feel overwhelmed. But yeah, go ahead.
or sometimes you have someone that quits and you have no idea why.
Right.
Um, and when you have those, monthly or quarterly check-ins, you kind of are keeping those lines of communication open. Because some people quit because they're bored, they're not given enough tasks or responsibilities. Some
Yeah.
people quit because of overwhelm, and they feel like they're doing the job of three people and they're just one, but the expectations are maybe unrealistic. But I think
Definitely.
that's something that you're doing that maybe more offices should be,
Yeah.
because you really don't know unless you ask. And sometimes you're so busy just getting through the day that you're not connecting with your team members to see maybe what their needs are, um, and maybe ways that they can be supported. And I think when it comes to leadership, that's one of the most important things that we can do is keep those lines of communication open to make sure that they're being supported and appreciated as well.
Mhm. Yeah.
We originally started them as performance reviews, just to have
Mhm.
a record, and if they were to ask for a raise in the future, there's a record in their file. Okay,
Mhm.
we talked to you about this. Has this improved? Right? Like, it's just keep for record keeping. So that was our first intention with it, but then we
Mhm.
kind of pivoted it. Well, let's not focus so much on the performance, because that's important, but let's make sure that they're feeling that
Mhm.
they're doing good
Appreciate it.
work, and
Yeah.
rewarding that we appreciate their hard work,
Yeah.
rewarding and appreciating um, their skills in their job, and we
Yeah.
want to make sure they love coming to work. Um, but yeah, having that open communication. How's it going? Like, let's check in. How are you feeling? How are you doing? What do we
Mm.
need to change? Do we need to make adjustments? Um, and kind of letting them kind of take the lead. And like you said, Maurice, listen,
Yeah.
tell me what's happening, what's in your world, what's going
Yeah.
on, because I just sit in my office, I don't know,
Yeah.
and I don't
Yeah.
know unless you tell me.
Yeah.
Yeah. No, and that's very good, Tamara, because I've made the point that regardless of who walks into my office, I stop what I'm doing, look up to them, and let them speak, regardless of what I'm busy with. I hate
That's
being
good.
interrupted, but I know that, and but my child now, I'm expecting them to do the same, to
Mhm.
to follow my example, because that just it keeps that door open. And if I'm really busy, I will tell them, say, you know what, I want to speak to you about this, but just not now. Give me a second. Let me finish this or
Yeah.
whatever. But if you let just show them that whenever they come, you will be there to listen. Um, that's the example that I'm trying to lead with. I don't always get the followers, but I think eventually I will get it if I keep doing it.
That's awesome. You got it, and I love hearing your experiences from your office because there's so many good things that you um, that are doing that we can all learn from, and that's one of the reasons why I created the study club is that
Yes,
so
exactly.
we can share our ideas, our successes, our struggles, so that we can learn from each other instead of
Yeah,
trying to
absolutely.
like figure it out on our own the hard way.
Yeah,
So
Absolutely.
I absolutely appreciate you both, being vulnerable and sharing your experiences.
no,
That's
no,
benefits all of us.
It's nice to have like another to bounce ideas off of, like you said. Um,
yeah,
and I'll keep going back. There was no office manager course that I could take
Yeah,
yeah,
I know.
to
yeah,
prepare me for this. So, right,
Yeah.
it's nice having someone out there just to um, feel. Sorry, I'm not
Mhm.
in the camera view.
Yeah, that's
Um,
okay.
to feel like there's
Yeah.
others. I'm not just the only one.
Yeah.
yes. I
Right?
think one of the things that
Yeah.
made the biggest shift for our clinic is when we realized we don't have to do things all by ourselves.
Mhm.
Yeah.
Surrounded ourselves with the right people and contacts and people. And yes, the moment you realize, oh shit, I can offload some of this or at
Mhm.
least handle this with somebody else. Yes, that changed the world for us.
Yeah.
Hmm.
Yeah. And you had mentioned, Tamara, that there isn't a course. It's almost like being a parent. There's no like there's no
Yeah,
there's no rule
exactly.
book when you give birth and have a child. When you
There's
become an
no
office
manual. They
manager,
don't come with a manual.
you know what?
Yes.
Sometimes we don't have manuals. We have to figure out things the hard way. And that's something that is actually on my to-do list this next year is to actually plan a workshop for office managers to actually come together and kind of get some experts in of like, okay, how do you do a what are the rules? Like what
Yeah.
can't you ask during a work interview? Because you have to interview people, but you never were trained how to do that
Exactly.
or how do I manage conflict? Because there's so much more than just the dentistry part of it.
Yeah.
It's being able to work with people and also making sure you're following the rules,
Yeah,
the rules.
absolutely. Payroll even. Like it's
Yeah,
AR, it's HR, it's payroll,
Yeah.
it's an encompassing role to be
yeah.
in. So that would be lovely.
Yeah.
Help
No.
people get
Sign
along and
me up.
manage conflict.
Yeah. Yeah.
Sign me up. There was a course that I did. It was like a level 2 reception course, and we thought it was like um, an advanced reception course, kind of for office managers or maybe
Mm.
receptionists who are interested in leadership and want to get into a manager position. Um, it was good.
Mm.
But like you said, there's no other managers there to tell you,
Yeah.
okay, this is how you
Mhm.
do it. This is how you don't do
Right.
this, do that, right?
Mhm.
Like,
Yeah.
um, so yeah,
Okay, we'll
I
keep you posted.
do it,
I did
do
it.
it. I'll be there.
Okay.
Yeah, yeah, I think that we will all benefit greatly from that. I did a course through UBC, the business campus that Jim
Armstrong?
Armstrong
Yeah.
did. Yeah.
Mm,
But I feel like that course is a little bit more directed to business owners,
like
Hmm.
which
dentist
in my
owners,
case
yeah.
helped me a great deal because my wife is the business owner, so
Hmm.
Hmm.
I'm almost in that role as well. So it helped me a great deal. I don't think true office managers would benefit all that, but there was good information about how bottlenecks in offices being managed and great stuff like that. Overall, overarching business things. Um,
Hmm.
but I like this idea of sort of a workshop for office managers, and let's get there and
Yeah.
brainstorm and throw ideas around, and yeah, that will
Yeah.
be
I was thinking like a full day, although
mm,
I feel like it'd be two two full days. But yeah,
Do
I
it.
think I'd like to organize that and get people involved that can really assist in their certain aspects of knowledge.
mm,
So yeah, it's to be continued. It's definitely on my task
nice.
list for
Yeah,
sure.
yeah.
But
Yeah,
and then
that'd be great.
I know our hour is almost up, but apologies for not getting the slideshow working. But that's okay. Sometimes you just have to run with things. Uh,
Can you share a PDF of your slideshow after
sure.
the
I was just
meeting?
going
Yeah.
to ask the same thing. Can you
Yeah,
share the
yeah,
slideshow?
that's
Yeah.
an excellent idea. So I'll send you both a couple of things that can
Yeah,
support our discussion today for sure.
perfect.
Um, And then just to kind of review what we said, some of the words that have really stuck out to me are like what you said with listening. I think the power of listening can be underestimated.
Mm,
Communication,
yeah.
um, having empathy. Is there
Yeah.
any other words that struck you through the conversation from today?
Yeah, a kind of theme for me where I'm at with at home and at work is this just to seek understanding
Hmm.
for the situation or for the person or for the information behind it, the scenes. Just seek understanding. No, don't make quick judgment calls. Just understand the situation better before you make any assumptions or
Right. Yeah, I think that's brilliant. Yeah, just and also listening to understand instead
Mm,
of like listening to respond or
yeah, yeah,
um uh yeah, and then having judgments. And I think when you have two opposing ideas or you have somebody that's on your team, they're struggling, you really haven't been through those struggles or you don't understand them, but just trying to ask questions, be curious, and then see where you can offer support. And I think the other thing I just wanted to mention is as an office manager, how we're oversee the team and making sure that they're doing well and have all the tools they can to
mm,
um, uh, be successful and also enjoy their time on the team. You want
mm,
people to come in and actually like their job, like the get along with the people they work with, but also do a little bit of self-reflection to make sure that you're also not suffering burnout. Sometimes you just say
yeah,
yes to everybody. You're not saying yes to yourself, and it seems
yeah,
selfish. Um, but it's important to know when you need to have a moment or have some space in the office designated for serenity or just breathing
yeah,
or sometimes you just need to walk in, even if it's just the lunchroom, just walk in, just like take 30 to 60 seconds to just stand, breathe. I
Yeah.
had a
Yeah.
dentist once that was upset with his office manager. He's like, I'm not mad. I just need a minute. He walked away. And so, just communicating that, right? Just say,
Yeah.
I just need a minute. I'll be right back.
I love that.
Right?
Yeah, that's
Sometimes,
awesome.
so, if you need a minute or someone on your team needs a minute, just give it to them. And if anything we learned today, uh, listen, try to understand and support.
Mm.
So I want to thank you guys for attending. I'm gonna I don't know if I'm going to be doing a June study club, just because on the day I was going to do it, I'm going to be traveling,
Oh,
and I usually take the summer months off. So if we don't connect next month, it will be in September. But
yeah.
I always invite um, everyone to feel free to email or ask questions, and basically this is a place for support and
Yeah.
encouragement.
So, no, thanks for doing this, Monica. It's always fun.
Thank you. Thank you,
Yeah,
Maurice.
thank you
Thank
so
you,
much.
Tara. Yeah,
Thank you.
You guys have a
pleasure
good
to have
day.
you too. Have an amazing weekend. Your yay of the day, it's Friday. And
Yeah.
Yes.
Sarah, keep us posted on how that uh, new service with your um, is it IV sedation
Yeah, it's
you're
IV
doing?
sedation.
Mm.
Yeah.
Yeah. So
Most practices do just like the oral sedation. But
yeah.
yeah,
Yeah,
we jumped
nice.
in. He jumped off the diving board with this one.
Yeah.
Nice.
Well, that's
I like that.
wonderful. Yeah.
Awesome.
Awesome.
Yeah, I'll hopefully connect with you guys again soon.
Yeah, that would be
Thanks a
great.
lot.
Have a wonderful weekend. Enjoy
Have a
your
good day, guys.
families and do everything you can to avoid burnout.
For sure.
I'll
All
Take
take
right.
care.
that to heart. Yes.
Exactly. All right. Take care,
Bye
you too.
bye.
Okay, bye-bye.
Bye.